I'm Columbus Batiste. I'm an interventional cardiologist out here in sunny California. Yes. And I am passionate about the heart, man. I love the heart. Protect the heart. I'm a protector of the heart.
You're a protector of the heart.
Protector of the heart, yes.
Wow.
That sounds like the title of this video.
Oh, protector of the heart.
Come on.
Okay, here we go. All right.
Excellent. So what you said, an intervention cardiologist.
That's right.
Okay, so can you tell the people what does that mean?
So in the traditional terms, what an interventional cardiologist is, that's someone who will try and stop a heart attack in the midst of it occurring.
Okay.
So what we do is we intervene and we will go ahead and try and unblock an artery at that point, at that moment, to hopefully keep someone from sustaining too much heart damage.
Right.
We also do other things. We dibble and dabble and start to work on heart valves and some different things like that. But our major focus are on coronary arteries and peripheral disease, meaning the arteries inside the legs and other parts of the body as
Okay.
well.
Wow.
So someone will come to you literally in the midst of a heart attack, and you'll be like, whoa. This is not going to happen. So how does it? Yeah.
Exactly. No, I mean,
Okay.
sometimes they will come in either about to have a heart attack or they start to kind of are having some warning signs
Okay.
that tell
All
us that
right.
they're kind of leading up to a heart attack.
Okay.
And that's when we'll go in and we'll take them into our suite and we'll go and take a look at the arteries of their heart.
Okay.
And then we'll determine what therapy needs to happen, if we should go ahead and open up the vessels or do whatever to it. So that's the traditional.
Right. So you said
Yeah.
traditional, which is what he just described, but you're not quite traditional, right?
Well, I mean, I believe in the best medicine.
Okay.
Right?
Oh, okay.
So
What is the best medicine?
The best medicine is not having to come and see me.
Oh, yes,
Oh.
prevention.
Yeah.
Yes,
So let's
yes.
just lay out some ground information. What is the biggest killer in the United States right now?
Forget the United States. Worldwide.
Worldwide.
Heart disease.
Heart disease.
Wow.
Okay.
Heart disease.
So this is very relevant.
Yeah. So you have a job.
I will have a job
Okay.
forever.
Okay.
All right.
All right.
So I mean, unless people listen to me. Now, if you
Right.
listen to me, you might put me out of work.
Okay. So what are we listening to then?
Well, you know, we have to. So I know, Morgan, you said something about prevention. So actually, I don't believe in prevention.
Okay.
Oh.
Right? See, part of the reason why I don't believe in prevention implies that we're going to keep you from developing heart disease. The problem is, heart disease happens before you have a chance to even think about what you want to do. It happens before the age of 10 and only worsens as you grow older.
Oh
Wow.
So what happens before the age of 10? Tell us a little bit more about that.
So that whole process of the arteries, so the arteries begin this process of kind of developing this plaque or obstruction, or think of it like if you're slurping through a straw and you're getting a nice fruit smoothie and you get a piece of fruit stuck in there.
Right.
So you can't get any of the liquid out.
Right.
So it's obstructed that
Right.
way. So you get this plaque or this obstruction in these tubes that deliver blood flow.
Okay.
That now blood can't get to the heart muscle
Right.
effectively.
Okay.
Now if that happens suddenly, then that's when the heart attack happens.
Right.
But that process of beginning to develop that plaque or that obstruction starts very early on, as early as the age of 2.
I had no idea.
It only worsens.
Wow. So what are some things that cause that plaque? So the plaque, we don't want the plaque.
You don't want the
You don't want plaque on your teeth or plaque in your
That's right.
arteries.
That's right.
So tell us about what that plaque is and how it happens.
Well, you know, it's comprised primarily of cholesterol. But, you know, the whole process of the arteries becoming dysfunctional is a process that includes diabetes and high blood pressure. But nutrition is a huge component that plays a role in this development. It's been shown. And so this happens not only early on, and then, you know, the thing is that you think, well, you're too young probably to have it, right? That's what you probably think. Oh, that's not going to happen to you, right?
Too young, or let me just put it out there, too skinny.
Yeah, or too skinny. Yeah, right. You say,
You're
no, it's
sick.
impossible.
Yeah.
But see, the thing is, that's crazy, right? They did these autopsy studies, which means after a person dies, they go in and you start trying to investigate what's going on with them. They found that 19 and 20-year-olds actually had occluded
plaque.
vessels. No,
Wow.
not plaque.
All the way.
Occluded vessels.
Wow.
Now these
Like
are people.
just
They
like
were
no blood.
90% blocked and
Wow.
restricted blood flow. So these are people who've gone through basic training. They're up there doing push-ups. They're doing squats. They're climbing over walls. They're doing all of this stuff, but they're killed in combat, or they've been killed in the car accident. And we found that they've had obstructed vessels
So even at a young age.
at a young age.
Wow.
At
So
a young
this
age.
is, you know, for some this might sound very despairing. Like, oh, there's no
Oh.
woe is me. So is there hope? I mean, you know, we are dietitians. We do believe in some
Hope.
preventive. Right.
Yes. Yes.
We're Christians too, so we definitely believe in hope. What can we provide? Like, is there any type of what can people do?
So basically, it starts and stops with nutrition.
Okay.
I mean, nutrition is the key.
Okay, let's just it starts and stops
Write that down, folks.
with nutrition.
That's it.
It starts and stops with nutrition.
It's simple. Yeah. It's simple. It's crazy that something so simple. We all know it, right?
Right.
Okay, I want to eat healthy. That is going to be, but it's better than the medications.
Okay.
It's better than the stents I put in. It's better than bypassing a lot of particular situations, except in the throes of a massive heart attack. Okay, in that situation, no, eating your fruits and vegetables is not going to cure a heart attack at that point.
Right.
But if you want to keep yourself from getting to the level of a heart attack, yes,
Right.
it solely starts and stops with nutrition.
So Dr. Batiste said it starts and stops with nutrition. So the start.
Yes.
Give us some more technical. Walk us through a typical day of how it can get started.
All right. So when you're looking at nutrition, I mean, so the first thing that we have to look to combat is the deadly American diet,
Okay.
right? So
What it is.
we know good and well the deadly American diet is just that. It's of no good. It's of no use, and that's led to the disease burden inside the United States. We know that amongst the number one killers in the United States, they're all lifestyle mediated.
Right.
Right?
100%.
So when we talk about starting that's going to start, how can we increase our grains, our fiber?
Right.
How can we increase our fruits, our vegetables? How can we increase the things that are actually feeding our bodies from a nutritional standpoint? Right?
So the standard American diet then is high in fats, high in animal fats, low in fiber.
Yes,
Would you agree?
absolutely. And but I also add to it high in
Sugar.
fat, salt, and sugar.
Fat, salt, and sugar.